Hello and welcome everyone. Today we have a special guest, my dear friend Carol Petersen. Carol is an accomplished compounding pharmacist with decades of experience helping patients improve their quality of life through bioidentical hormone replacement therapy. She graduated from the University of Wisconsin School of Pharmacy and is a certified nutritional practitioner. Her passion to optimize health and commitment to compounding is evident in her involvement with organizations, including the International College of Integrative Medicine, the American College of Apothecaries, American Pharmacists Association, and the Alliance for Pharmacy Compounding. She was also the founder and first chair for the compounding special interest group, the American Pharmacists Association. She is chair for the Integrated Medicine Consortium. She co-hosts a radio program, Take Charge of Your Health, which, by the way, you guys should listen to. Even though it's in the greater New York area, I'm sure it's available online. She's also on the medical advisory board for the Center for Menstrual Cycle and Ovulation Research. And I strongly advise everyone who is watching this to go to Carol's website. She writes an amazing blog full of information. And I'm sure everyone will find it very interesting and educational because she is an expert on many subjects, and I learned a lot from her. And the website is the Wellness by Design Project. Again, it's wellnessbydesignproject.com, the wellnessbydesignproject.com. So welcome, Carol. I think I'd like to ask you a few questions so that,
great,
because a lot of your expertise lies specifically in hormone-related field. So, but I understand that we also are interested in connecting cholesterol and hormones. So please take it
away.
Yeah, take it away.
Thank you. Thank you very much, Alex, for having me. And thank you to all the listeners. I hope you learned something. And I'm really excited to be able to share some of this. I feel that in general, so much vital information is being withheld from us, or we're being deliberately taken astray. And nothing could be truer than in the case of cholesterol. Even though really the medical field knows better, but we have entrenched a system where we say cholesterol is bad if it's elevated, and we have to do all sorts of things, lifestyle modification, diet modification, and drugs to limit our cholesterol. What people don't understand is how important that cholesterol molecule is. And I've been researching this a little bit. Not only is that cholesterol the precursor for important hormones, and I'll list them here, the sex hormones, estradiol, progesterone, testosterone, DHEA made by the ovaries and the testes, but then the adrenals. And that's our most prevalent hormone. These are all called steroids. Cholesterol is a steroid. These are all steroidal hormones. And then in the adrenals, as I mentioned, DHEA, pregnenolone, hydrocortisone, and all the anti-inflammatory type steroids are made by the adrenal glands, which keep us from reacting to every single thing in our environment. So all these hormones are vitally important to our functioning. Then there's also vitamin D, is a steroidal hormone, really. It's misnamed a vitamin. And that particular molecule is so essential. If we've learned nothing more from this whole issue about viruses attacking us and whatnot, we should have learned how important vitamin D is, because we're finding that every single person that is in danger of becoming sick really is critically low in vitamin D. And it's even a bigger problem in the northern latitudes as we live in. We can't even get enough vitamin D through our skin as we should. We probably should move en masse over to the equator to get that accomplished and spend many more hours in the sun. So we just can't do it. In fact, in Canada, they stopped allowing for payment for OHIP, for checking your vitamin D level. And they did this because they already know everybody is low. So it was foolish to spend the money on confirming that you're low. But rather than just act on that information, the government really doesn't tell us to make sure our vitamin D levels are adequate. And that should be essential in this time of making sure our immune systems are functional. Vitamin D has so many elements in keeping your immune system working that it's essential. And the first word out of any public health agency and the government and your doctor should be your vitamin D status. It's that important, made from cholesterol. So then we also have bile. And bile is secreted by the liver and stored in the gallbladder, and it's released when you eat a meal with fat. In order to absorb that fat, you emulsify it, mix it up with bile, and then you can absorb it. So people who have low bile have a real big problem. And it amazes me how many people who have had their gallbladder taken out are never advised that they need extra bile when they have a meal with fat in it. It would help them so much with the absorption of the essential nutrients that they need.
Totally agree with you. And
Yes.
Many people are not even told after they had their gallbladder removed that, number one, they have to watch out for fats, specifically fats in baked products, commercially baked products, because these are industrial fats usually. But they also need to supplement with digestive enzymes to help absorption and of their foods. But coming back to cholesterol, I understand that cholesterol levels usually get elevated as we age. Is that a sign of a hormone imbalance?
It can be. One of the things that's not addressed in conventional medicine is if you're going along and your cholesterol's a certain level and it starts to rise, why is it rising? Mm-hmm. And one of the reasons is that you have some difficulty in making the hormones that you should be from cholesterol. Now, why would that be? If you wanted to take a look on Wikipedia and look for the steroid cascade, or maybe you can even attach it to this video someplace. When you look at that, you'll see how complex it is. And each step to make one hormone from another to another to another requires a coenzyme, that's another word for a vitamin, or a cofactor, another word for a mineral. So any deficiencies along that cascade can create a problem in making hormones. So your body responds by making more cholesterol, trying to give your body more of the raw material for building blocks to make those hormones. There was a famous Danish researcher by the name of Jens Muller. And we have this information and we know how to do this, but you never see it being applied conventionally. One of the good things to do is look at the good old stuff in medical literature and stuff. People, our ancestors were not stupid people and they were great observers. And some of that knowledge is just buried over the conventional viewpoints and the propaganda that we're subjected to. So Jens Muller treated patients who had critical heart disease, and they were in danger of losing their limbs from wounds that wouldn't heal, particularly happens in diabetics. And so he would use very large doses of testosterone, which is the hormone that really directs protein synthesis throughout your body, so rebuilds you. So with that large dose of testosterone, he was able to reverse some of these issues. And the interesting thing is he wrote a book about his project, and he called the book Cholesterol, because what he observed when he treated these patients who were low in testosterone and gave them testosterone, their cholesterol came back down. So they were no longer needing that higher cholesterol because they were able to make that hormone. Another place where cholesterol rises is during any kind of repair. All of the cells in your body have a membrane which surrounds it, and that membrane is made of cholesterol and some other things, fatty acids, but cholesterol is the main thing. So anytime you're rebuilding, your cholesterol levels will go up, and that's important. We never measure cholesterol levels in pregnancy because we know they go sky high, and how would you talk about this and not treat it because it's so sky high? But you need that high cholesterol because you're really building another whole body. All that building material is absolutely necessary. Another thing that's vitally important is from the molecule cholesterol, the next hormone that you make from that is called pregnenolone. Pregnenolone is a great anti-inflammatory. It's been associated with a memory. It's being used in traumatic brain injury with great success to relieve the inflammation in the brain. It's very active in the brain. So to get to that next step requires active vitamin A. And we can get vitamin A from fish, especially sea fish rather than river fish, and fish livers. We know about cod liver oil is loaded with vitamin A, eggs and milk, fatty things. Some of the animal fatty things have good sources of vitamin A. We also have precursors to vitamin A in the form of beta carotene. And beta carotene, you might want to think about carrots. Remember how we're always told to eat carrots, it's good for your eyes. So it's vitamin A that's really needed. But we found that a number of people cannot convert beta carotene to vitamin A adequately. Sorry. So if you can't do that, why is the reason you can't do that? The reason is if you're low in thyroid, you cannot make that conversion. A doctor named Broda Barnes, who worked out of the Chicago area for 3 decades, he studied thyroid. And he said that a high cholesterol level was the best test for low thyroid, beating all of the other conventional tests that we use. So if you're looking into your thyroid problems, consider that cholesterol level too. And this is only if it's gone a change and has gone up, that you may want to look at that as see if your thyroid activity has gone down.
So let me just clarify that, because you're saying that if there is a drastic change in your cholesterol levels, it may also indicate that your thyroid is hypo or under functioning?
Right. And why I say that you can have a change is if you were to list all of the things, environmental and drugs and food and stuff that interfere with your thyroid function, that list would be as long as my arm. It would go on and on. There are 3 things that support thyroid function. And this is according to Dr. Ray Peat. He said pregnenolone, progesterone, and coconut oil. Remember, I was just saying we were talking about that conversion to pregnenolone. Mm-hmm. So when you get in this cycle, you get into a vicious downhill thing. You need active vitamin A made by your thyroid. So you have pregnenolone, but pregnenolone would have been helping, but you don't have it. So you're in a loop. And if you don't break that loop, and it could be as simple as changing, depending on vegetables, for vitamin A to the animal sources of vitamin A, that could break that downhill loop. Another thing that happens with the statin drugs is that they don't reduce plaque. And we're kind of sold a bill of goods on what's going on with our heart.
Right.
We've probably seen these terrible pictures where surgeons have opened up an artery and it's full of plaque and it looks hard and it looks fat, and it's from cholesterol building up. But why is cholesterol going there in the first place? It's usually inflammation of the endothelium, the lining of those arteries. And one of the biggest things you can look for in an evaluation is a homocysteine level. And this is an intermediate pathway to produce other substances in your body, but people get stuck and have more homocysteine than they ought to. And it was shown that this is a very irritating molecule to be wandering around in your bloodstream, and it does irritate the endothelium. So what happens? You go to patch it up. That's the function of cholesterol. It's supposed to help you rebuild cells and stuff. So you go and patch it up, and there's calcium in there. And sometimes there's other things. Sometimes bacteria colonize those patches. So that's definitely dangerous and impeding circulation in your blood, which you don't want. However, for many reasons, you can have cholesterol go high, and it might not have anything to do with what's inside your arteries. You can have a CAT scan called a calcium score, and it will show you how much calcium is being stored in your arteries.
Right.
So the more that this is happening, the higher the score. You can also have this occasionally and see if some of the techniques you are using will bring that calcium score down. The statin drugs don't do it. People have in their mind that the statin drugs are like a liquid plumber or something. They're going to clear you out. Yeah. Well, they don't. They don't.
It's not that the people have this. Their physicians myopically just look at cholesterol scores and automatically prescribe statins, and that's why. And of course, it's a blockbuster drug. Lipitor, when it came out, it was in billions and billions of dollars a year. So it kind of created this whole. I hate to use the word pandemic of medicating people that basically have no issues with cardiovascular disease or not even at risk for cardiovascular disease. And now almost every physician checking blood of their patients will automatically check for cholesterol instead of checking for hormones, for instance. So, right. So what you're saying, as I said, it's kind of bordering on medical heresy, but it does make sense. What do you think happens when we suppress people's cholesterol levels artificially with statins? How does that play a role, and what's the effect on the hormonal level? Because as you mentioned previously, it could be a hormone issue and not necessarily a cholesterol issue.
Right. And supporting those hormones could make a big difference, and cholesterol will just pop right down because it's no longer needed to pump out like your body was trying to do to make more hormones. You sort of ease that off. So if you put a statin drug there, you're unable to make cholesterol adequately. In fact, I just want to deviate a little bit. Dr. Joel Kaufman wrote a book called Malignant Medical Myths. This is definitely one of them. And in one chapter, he talks about a life insurance company that did a massive study. They were looking for the best level of cholesterol for longevity because they're in the business of how long are people going to live? What are the statistics? And interesting enough, what they found was the level of cholesterol was 270 associated with the best longevity. And I don't know the Canadian equivalent numbers, But that's relatively high. To put it in context with the US, by our expert committees who are all influenced by drug company money, very few people aren't in this day and age. So by committee, they've decided 180 was optimal, with no real proof, because we've been shown by this other study a higher cholesterol leads to better longevity. So what are you trading in for losing that longevity? You lose your hormones, you have all sorts of side effects, and one of the biggest has been muscle pain and even muscle damage. That's if you don't do it early, correct things early, that this could continue and not reverse even when you later stop. Or one pilot wrote a book about blindness being caused by one of the statin drugs. The stack of side effects is huge. If you just consider that you can't repair, you can't make vitamin D, you can't make bile, you can't make hormones. With the cholesterol that you're not getting, the side effect potential is horrendous. And it just boggles my mind. There's no study that shows any benefit for women to use a statin drug, yet if your cholesterol's gone up a bit, you're going to be plopped right on it. And for men, the only study that showed an improvement was one that was in a post-stroke group. So in this study, 1 out of 200, they believe, had prevented having a second stroke. So that meant that 199 men had to take a drug that was doing all this damage to their body, plus the cost of the drug, so one person could benefit. And even so, maybe that wasn't the reason anyway. You know, studies have many variables and you can't pull out every single thing. Studies are designed just to look at one parameter.
At best. At best. So, and I wonder how many kind of adverse reactions from statin drugs are not being reported as well. You know, because not everything is attributed. You know, if you don't understand the connection, then you would never even figure out that there is a connection, right? So you can only find something what you're looking for. If you're not looking for it, you're not going to find it. Let me ask you, what would be your choice of good, because cholesterol is such a complex issue. You know, we're obviously looking at saying cholesterol, you know, there are so many subsets of cholesterol. There's good cholesterol, there's bad cholesterol. What would be a good dietary source, number one? And number two, well, let's start with that. Okay, I have a couple of more questions.
Okay, so how could you help manage your heart disease without turning to statin? Am I rephrasing your question correctly?
No, I'm not suggesting that you know, we can. No, I'm not even talking about heart disease right now. I'm strictly saying, you know, what would be your dietary choice for cholesterol in terms of good quality cholesterol?
Okay, so we eat cholesterol. Cholesterol is found in all animal foods. It's not found in plant foods. So we will have it. And there is a danger. People don't realize either. There's a danger in your cholesterol being too low. As I said, 180. We've had studies with autistic kids with cholesterol levels like 100 or 110. And they have all sorts of problems, as you might imagine. So their levels are even untreated with statins, they're very, very low. And so there actually are supplements of cholesterol, or you could be supplementing pregnenolone, maybe the next hormone, as I said, is so important in inflammation and the working of the brain. So people could be doing that. And they've also found, as they drove down cholesterol levels with statins, is there's a higher mortality in people for all causes with low cholesterol.
Right.
Which is kind of shocking. And in particular, there's a high incidence of cancer in these patients. It's so important that you have adequate cholesterol and yet making it the bad guy. And then we do subsets of carrier proteins, and we call one good and one bad. And this is something I really hate to see. We have it in the hormone field too, like they're saying good hormones and bad hormones for your own normal hormones. So it's all relative. Yes, you can have an excess of something. You can have a physiologic step being blocked by something not being there to manage it. So that's not a reason to call it bad. It's a reason to look for the metabolic dysfunction that's occurring to have something accumulate that's outside of its normal values. So this is all rubbish about good cholesterol, bad cholesterol. If you have a CAT scan and you have high cholesterol and you have no buildup in your arteries, why would you use it? And that's one thing you could do that calcium score. You might not have any buildup in spite of the high cholesterol. Like I said, there are many reasons for it.
Right. By the way, do you know if CAT scan calcium score tests are available in Canada?
I don't. I know it's available in parts of the US, and it's just a walk-in. You can order your own, which is handy, and it's not particularly expensive. They tend to be around the older communities like Florida and Arizona, those kind of clinics. I really don't know, and it would be good to know.
Right.
Jeffrey Dash wrote a book called Heart, and that was one of his main contentions, that you're better off monitoring your calcium score and making some changes. This book is a little bit like a cookbook, recommending various nutrients and changes to help diminish that calcium score. And he believes you should check it periodically, and you want to at least stop the increase, keep yourself where you are, but it is possible to get rid of it with nutrients. Vitamin C is particularly good at helping you mend your arteries and get rid of the plaque.
There was also a book, I forget the name of the author, which is a Canadian naturopath, that was also kind of relating to D3 specifically, and metabolic issues when it comes to plaque and cholesterol as well. Again, the name escapes me right now. What would you suggest to women that need to not only to check cholesterol levels? Everybody is doing that already. I'm hoping that more and more women will insist on checking their hormone levels, like you've mentioned, DHEA, specifically because low DHEA levels have been attributed to, again, higher mortality. Most likely, you're likely to get some kind of disease or an illness, as well as you age faster. Many women don't, I mean, men too, but many of us don't realize that low DHEA levels basically indicative of faster than average aging. So maybe that will spur some people to talk to their physicians, because nobody wants to age. And at least if we age, we want to age gracefully. So pregnenolone could be checked, DHEA, cortisol, progesterone, testosterone, estrogens, estriol, estradiol. What else? And maybe C-reactive protein to check for
inflammation.
Anything else?
Ferritin might be good. It's also an inflammatory marker. Homocysteine, as I mentioned before, and the correction for a high homocysteine is B vitamins. There's a deficiency of B vitamins going on to metabolize that homocysteine into less harmful molecules. And there's another little piece of this. Several of Bs do this, B3 and B6 will do it. But there are people who have trouble making active vitamin B. We have two kinds of supplements on the market right now. We have the pre-vitamin products, and they tend to be cheaper. And then you can find a methylated group of B complex vitamins. And the methylation process is done by the liver. It puts a methyl group on, it makes this, actually now the vitamin has become active and does work. The problem we've discovered, and this is fairly recent discovery, is there are those among us who don't methylate very well. We have problems with our liver doing this as efficiently as it could. And so if you take a regular vitamin B complex and expect your homocysteine to go down, it might not do that reliably. So you might want to choose a methylated vitamin. And unless you want to do the testing for it, this actually comes into some of the DNA testing that people have been doing lately. And you can actually pick out deficiencies. Like, for example, I did a DNA test, and I used a platform to look at what nutrients I should look at. And one of the interesting things that came up with me is I have a vitamin D receptor resistance. So how do you overcome that? Well, I've got to use more vitamin D than average to stimulate those receptors and get my vitamin D up and active. So it's possible to look into whether you methylate efficiently or not with these tests, but not having the test, you could just go ahead, buy the more expensive product, and it's already in the active form.
So I was going to ask you, how do you differentiate? Is it just the price alone, or how do you differentiate between kind of good quality nutraceuticals and, in this case, vitamins versus poor, or I should say kind of sub-quality?
Right, that would be one of the things as you look on the label. You look for the methylated versions of the B complex, or they're
and
not.
It would actually state methylated?
Yeah.
Okay, that's great.
It will.
It
will. It could be in a multiple, or it could be in a B complex product.
I see. So
it's actually there, and that's a wonderful question, because you can find out so much information. Remember, as I was saying, how vitamin A was so important in that particular step from cholesterol to pregnenolone. So there are supplements that have so-called vitamin A, but if they say vitamin A as beta carotene, then you're just getting the carrots. You're not getting cod liver oil type of vitamin A.
So what should I be looking for?
You would look for vitamin A as it's usually retinol palmitate is how it's on the label. The FDA in the US actually just made this ruling. They're going to treat beta carotene as being equal to vitamin A. On labeling, they're going to allow that, and that's another big hoax. So people will be looking for activated vitamin A and not getting it. It's a horror. So
listen, as I mentioned when we started talking, that you are a treasures trove of all sorts of information, and I don't want to overwhelm people. And I'm sure some of us are starting to feel overwhelmed because you're just opening up more and more conversations. Perhaps we should do this again, and because there's a lot of information. I just wanted to remind everyone again that, as you can see, Carol is very knowledgeable, not just in one subject, but in many. I've known Carol for quite a few years now, and every time I would go to a medical conference, she would be there. Now, maybe a couple of times a year, but she made it into a career. So I usually don't envy people, but I've always envied you for being so open to learning new things and also teaching. So again, once again, I wanted to remind everyone that Carol has a fantastic website called thewellnessbydesignproject.com. Please go there, subscribe to her blog. You will get notifications, and I can guarantee you that you're not going to be disappointed by the information that you get. Carol is very knowledgeable, and it's just a small little fraction of what you're getting out of this interview. You can read it at your leisure, of course, and you can learn with Carol as she continues to her journey on learning and also teaching about health and nutrition and hormones. And, there's so many subjects that are covered there. So listen, I want to thank you once again. We definitely need to do this again because, as I said, there's so many things that we can talk about. Thank you so much for sharing your knowledge, your wisdom. And I hope we can do this again soon.
Okay, I'm in. My pleasure.